Hi, my name is Allison Kazicki, and today I'm going to tell you about the role of artificial intelligence in healthcare. So I'm going to let you know what people in the healthcare industry think about AI and if they think that it's something that we need to move ahead with or something that needs to be kind of pushed back until the future. Some reasons that people think that AI is a good thing to have in healthcare is that it's been shown to improve patient outcomes, um, and it saves resources long term. So that means money and time, which is really valuable, especially in the healthcare industry and hospitals. Some people think that it's actually a bad thing because in the short term it costs a lot of money to implement. It's also very difficult to implement effectively. There are a lot of issues that make it difficult to switch the patients over between old systems and new systems. Some worry that the patients might fall through the cracks and get lost, or their health records may be lost. Another reason is that providers generally do not have the time to spend a lot of energy learning a new software or learning a new system. And if they're running around tending to patients all day, they really don't have the desire really to spend all that time working on the computer when they could be helping their patients. So I'm going to go a little more in depth into each of these reasons, and then we can decide if that's something that we should go ahead with or if we agree that we need to put it off till the end. So with difficulty in implementation, a lot of the issues that come from implementation are that it's very complex. Artificial intelligence is an extremely complex system, and it could take months, even years, to really get it fully integrated into a hospital system. So with all of this difficulty comes cost, and a lot of the time hospitals really do not have the resources to be pouring into this, especially if there's a lot of pushback against it from providers, and there usually is. Another issue with implementation is with all this difficulty comes the worry that some patients may get lost in the transition. So if some patients are in the old system and don't get carried over to the new system, then their records could be lost and they could actually suffer, their outcome could actually suffer due to this problem. However, AI professionals have gotten to the point where new programs are being developed so that this transition is made easier and more painless for everyone involved. This will keep it so that costs are reduced significantly, the time spent integrating is reduced significantly, and overall it would be a better experience. These programs are popping up all over the place and should be very commonplace by the time AI becomes commonplace. One reason for the implementation of AI is that it has been shown to improve patient outcomes significantly. So the reason for that is that not that providers aren't doing a good job, but because they are human, and humans are subject to forgetfulness, they are subject to fatigue, they are subject to mistakes if they are overworked or tired, and all of these things contribute, unfortunately, to patient mortality. And with AI comes the opportunity to remind providers of medication times. It could alert a provider to an emergency. There are a lot of things that AI can do to supplement the care of a provider, not replace them, but simply to make their jobs easier and to improve their job performance. However, one thing that the providers do worry about is that it's very difficult to learn. As I mentioned, it takes a lot of time to learn a new system, and the providers are not interested in spending that much time. Even though it will save them time in the long run, in the short term, they don't have that kind of time to invest. However, ICT professionals have been developing something of games. They have been developing games to allow the providers to interact with the system in a learning capacity in their own time, and it's not a performance thing. It's not something that will directly affect their patients. These games are just to help them learn the program. It's to give everyone in the hospital or everyone on the floor the opportunity to start on the same page. So they all understand the software at the same level, and then they can go from there. And that has been shown to improve patient outcome or improve provider competency with the system and overall make the transition a lot smoother. So in conclusion, I think that we should move forward with this technology, but we need to be very intentional and very careful with how we move forward. Otherwise, we'll experience mistakes, and time loss and other things like that, which are obviously things that we need to avoid. So we just need to be very careful, and hopefully we should see some good results from it. Thank you.